We have Lucien here. He's been my patient for a long time, almost 10 years. I've been doing nerve blocks to help him with his low back pain. But we decided to go a little bit further. So we sent him for surgery here in Canada, which wasn't really successful, and they did microdiscectomy. Then another surgery wasn't successful, so I discussed with him going to Europe. So I went to Poland and had surgery. And again, it was successful to a point that relieved some symptoms, but he wanted more. He wanted to go back to his full activity with his kids and his wife and be able to walk and exercise and do more. So we finally decided to send him for another surgery, compared between going to the United States or going to Germany. And then he found that Germany will be able to do the surgery that he wanted and with the results that he was looking for. So could you tell us a little bit more about the surgery that you had in Germany?
I've been working with Dr. Damien, as he mentioned, for more than 10 years or so. I've been very fortunate to have his guidance and help through this. So we decided to look for an alternative way of doing spinal reconstruction. So I found a clinic in Germany where we did an anterior lumbar interbody fusion for 2 levels at L4, L5, L5S1. And we also did an artificial disc L3, L4 to preserve the mobility of the spine and conserve the L3, L4 disc. So far it's almost 11 months. Been happy with the results and looking forward to a full recovery.
Yeah. So now he's having a little bit of problem with his SI joint, which usually normal after this kind of surgery. After you fix the surgery and you align back the spine, unfortunately it put pressure in the SI joint, which is the sacroiliac joint, where the pelvis connect with the spinal cord at the tailbone. Very minor problem, and Dr. Higazi today will perform radiofrequency ablation as well as PRP injection under fluoroscopy. It's a very successful procedure and is actually way more superior than having a surgical solution and SI joint fusion. So Dr. Higazi, would you tell us what you're going to do today?
So I was explaining to you that this SI joint has a complex nerve supply. So under X-ray, we are going to see where those nerves are. And we're gonna burn them, like heat that nerve up. It will take a few weeks to start to feel the difference. And after we're done with the ablation, we're gonna put some PRP, which is your own platelet. And we hope that would help for regeneration of inflamed tissue around the area, okay? We're gonna put some inside the joint and some over the nerve that we're gonna burn.
Yeah, and usually that increases the success rate for this almost to 100% of this procedure. We've done RFA before. He had a great success, but almost 70%. Again, Lucien wants a little bit more so that he can go back to his normal life, back to work and enjoying his family life. And we decided to try the PRP with the RFA today.